Live from our news hub here at Nsiah in Kanda. This is News 360. My name is Alfred Okansi.
And I am Nsiah Asare. Top of the bulletin this evening.
News 360 headlines is brought to you by Deluxe Paint.
Having insecticide spray and coil.
Piccadilly biscuits
And
My Life Insurance.
No bed syndrome persists as patients admitted at Tema General Hospital sit in chairs for treatment.
Business and academic activities grind to a halt in Cape Coast metropolis following severe flooding.
Meanwhile, Cabinet has approved a $200 million facility for Accra Resilience and Integrated Development Project with the view to tackle flooding. And our agenda for this week is the no-bed syndrome. We're trying as much as possible to put more attention on the menace that has killed lots of people, led to people losing lots of life. And patients admitted at the Adult Emergency Center of the Tema General Hospital sit in chairs to be treated due to lack of beds. This contrasts now the stance of Director General of the Ghana Health Service, Dr. Nsiah Asare, who says the issue has been addressed after putting in place a bed management bureau. Here's a report by Josephine Ncheje.
Joanna says she's been attended to in this chair for the past 3 days.
I came here, I didn't get a place to sleep. I was seated in a plastic chair. So some man stood up yesterday and I have to take his position. I came here with a sickness. I'm going back to my house with another sickness again. That will be back pain and other pain. So the government should help us. We need beds.
Others were equally worried.
I
have been struggling to sleep in this chair for the past 3 days.
I've been admitted, but I have no place to sleep, so I'm stuck in this plastic chair. Nurses say, according to the hospital's policy, patients should not be turned away. As a result, the best they can do is to rely on chairs.
When the bed is full and the whole place is congested, we still don't turn away patients. When they come, we have plenty chairs, so we nurse them on the chair. Whatever needs to be done for them, we do it appropriately.
George's wife is on admission.
This afternoon, I took her to surgical department, and lo and behold, we got there, there's no bed. So we have to return back to emergency ward. And I'm surprised, but I just want to ask the authority of this country that this equipment, are they not duty-free? If it is, then what are we waiting for?
The 294-bed capacity hospital is the biggest referral facility in the Tema metropolis, attending to cases beyond its catchment area, including some from Ada and the Volta region. About 300 daily OPD attendance is recorded, with more than 100 cases booked at the emergency unit. The child, adult and accident emergency centers are always under pressure.
Another challenge that hospital authorities here are battling with is the fact that patients who are on admission at the main ward who have been discharged and yet to settle their bills are still occupying the beds. So it makes it virtually impossible for them to also release patients from here at the emergency to occupy such beds.
Hospital Director Dr. Richard Anthony says the no-bed syndrome is a multifaceted problem.
The turnout of patients here is very high. And if you look at percentage bed occupancy, it's about 128%. And then patients averagely stay for about 8 days on admission. So you see that if a patient has not been discharged, which means there is no room to admit.
But in an earlier interview with the Director General of the Ghana Health Service, Dr. Nsiah Asare said the service is collaborating with some hospitals in the Greater Accra region to deal with the problem, adding that the issue is not lack of beds, but rather improper utilization of the beds.
I'm very happy that even if you are, since that time, I haven't heard of any major situation which has happened of late. And I'm hoping that nothing like that, like no bed, happen anymore. Kolebu and the Ghana Health Service is working closely together to make sure that it doesn't happen.
Ensuring healthy lives and promoting well-being at all ages is essential to the Sustainable Development Goal 3 by 2030. This goal will require improved skill delivery and care. Josephine Nchiaje, TV3, Tema.